Got it.
Stop video, pins, rename, allow multi-pin, put in waiting room, remove, report.
There may also be a button that I don't see, which is something about meeting settings on the bottom.
Yeah.
I can also just send you the slides.
Oh, who can share? I'm just gonna say, here we go.
All right. Ta-da! Outstanding.
Okay,
All
so I
right.
just talked to Rob and he's not feeling well. He's not going to join us, but he said he never received the email.
Oh.
Okay.
So I said I would let Pam know, even though we've already talked about that.
All right. So I'm just going to then let's call the meeting to order. It is 6:33. Here's the agenda. We have one agenda item that we want to go through, which is just to talk about what's going on in the world of COVID right now. This came about primarily because, in the absence of the state mandating things and the state of emergency where the town can just dictate things and say, we're going to do this and this, it seems to me that it seemed to us by their last meeting that there's a role for the Board of Health, the Board of Public Health to sort of, decide what actions we can take or what actions we should take and deliberate them. And then also provide some, advice or support to departments of the town that could benefit from this. For example, the school department, as they're having a hearing next week to talk about this. But what I thought I would do is I would share a summary of sort of where we are. This is the data that Pam sent. I've also collected a bunch of data from the CDC website and from the State Department of Health. Basically, this is where we are. We have an excellent vaccination rate in the town of Cohasset. Basically, if you look at the overall numbers, almost 80% are fully vaccinated. I'm assuming. Can you see my cursor?
Yep.
Yeah. Okay. Good. So we're at 79%. The state of Massachusetts is 63%. We have 88% that have at least one dose or partially vaccinated, which suggests that if people follow through, that we'll have almost 90% of the town vaccinated, provided that if they, follow through on their course within the next few weeks, which is great. And if you look at the higher risk age groups, we are at or above the state. So here's the town percentages versus the state. We're generally at or above that number compared to the state. So the town's in pretty good shape. The Delta strains now arrived, makes up the vast majority of new infections, according to the Centers for Disease Control. It's the challenge with the Delta strain is it's 2x more infective than the previous strains. The Alpha strain, you could infect one person, would typically infect two others. Now we're upwards of infecting 5. There's evidence to suggest that you could get more severe illness due to higher viral loads, and those higher viral loads also translate into the potential for vaccinated people to transmit the virus, even if they're asymptomatic. And in addition, because of the virulence, now we have a higher number of breakthrough infections. So this is our new reality, as you all know. And so we have breakthrough infections. They're relatively rare, but we have to consider them. As I mentioned, they're more common with Delta than the other strains. 0.01% of vaccinated individuals have had breakthrough infections. This is CDC data. 3/4 of these are in folks that are 65 or older. And then when we look into the breakthrough cases, 0.02% have succumbed to COVID, and just under 0.01% end up with severe enough symptoms to be hospitalized. These are both Massachusetts data points. And it also appears one of the benefits of being vaccinated is that that it appears that it's possible for a person to be less, although infectious, maybe less for a lesser period of time. And so the endpoint, of course, is that vaccination is clearly reducing the morbidity and mortality, which is a good piece of news. In terms of infection rates in Massachusetts, as the last data that I think this is the data that I got from their website, from the state. We have a lot of young people getting infected, but no mortality in the state. So about 4,300 between the ages of less than or equal to 19 up through the age of 29. We have 4,300 cases altogether. The mortality is higher in the older population, and so if you look in the same date range as we saw before with previous strains, more than half of the mortality is in the 70 plus age group. And so what sort of brings us to this point is now we need to think about working towards the desire to lower infection rates across town and across society is mainly to reduce the risks for the older population, just like we think about when we think about the flu. And so the reason we got together today was just to talk about, just in general, what sorts of things should we be thinking about as the Board of Public Health? With this, the state has some guidelines, but very few, if any, mandates. So what's the role of our town's Board of Public Health at this point in time? Do we need to discuss mandates of masking or in schools or businesses or town facilities? So if you look at, I just read an article that the town of Belmont is requiring indoor masks in businesses in town. There's a lot of interest and enthusiasm, particularly among teachers, about mask mandates in schools or in town facilities. There's for example, in the rec center and places like this, can we or should we mandate masking, especially in these facilities and businesses where we're talking about unvaccinated populations like kids under the age of 12. And if we don't want to do mandating, which, who knows, what can we do to encourage masking and give people, businesses, and our, town departments the tools they need to be able to encourage masking without creating more, sort of outrage and pushback? What can we do to be helpful? There's also now an emerging practice, which I'm kind of not, I don't know, I have mixed feelings about it, about proof of vaccination. The New York City is going to be requiring proof of vaccination as of the 16th of August to go into restaurants. My own university is mandating proof of vaccination. And there are some restaurants up here. I'm up in Portland, Maine right now. There's some restaurants in Portland that are asking for people to show their vaccination certificates to go into their restaurants. So I just wanted to tee all that up right now, just to see if these are if we can, sort of talk about this a little bit and see what we have and what's on everyone's minds, and also what other sort of things that I've teed up that I have not teed up that we should talk about today. So I'll just leave that slide up there, and I'll put you guys over here so I can see you. Thoughts from anybody?
So I guess right off the bat, I'll say my biggest concern is the unvaccinated population. So those that can't get vaccinated. And as you know, I have a kid who's too young to be vaccinated. So I think in terms of mandates, I feel like it's clear cut to talk about vaccinated versus unvaccinated, especially when you have asymptomatic carriers. And you'll have a population of unvaccinated kids going back to school together. I think it's less clear for me when it's people that are vaccinated, right? And you can't, and the mandates, but being in terms of schools, I know we all don't want to do it, but from a public health standpoint, I feel like we would be doing a disservice to not encourage, if not mandate, the requirement of masks for kids who are not vaccinated. Because you can't protect the kids who have are susceptible, to have immune issues, there's no way to protect them. So
Yeah, my thinking on the schools is, I mean, so the breakthrough rate is relatively low, right? I mean, it really is. And those where it is breakthrough, the likelihood of being severe illness is, unless you're in the higher age groups, is actually pretty the risk of severe illness is pretty manageable. It's pretty manageable. But it's the where's the responsibility of, well, first of all, let's be clear. We had no examples of in-school transmission with masked kids, right? So that, to me, it makes that, I personally think that, if we're going to mandate masks in schools, I think it actually should be everybody, simply because of even if there's a low number of breakthrough cases, the fact that they can still transmit this particular strain makes me think that we should probably, encourage the schools to go back to what worked. But there's a lot of tension here, right? There's a lot of people have strong feelings about masking. And so it's going to be interesting to see, actually. So as I mentioned, the school department is going to be discussing this at a special meeting next week on Tuesday. They asked Pam and me to sort of be there just to represent the Board of Public Health.
Mary will be there as well. It's actually Monday night, Michael, Monday the 16th.
Monday the 16th, right? The 16th. That's the number ahead of my head. And it's going to be interesting to see. I mean, the school department may decide to just do it themselves without us having to weigh in. But I think that it's going to be an interesting conversation. I think it's quite a touchy subject among many, if for no reason, then no other reason than just sheer frustration.
So can I ask, so anecdotally, Mary, has there been any transmission during rec camp?
So I can tell you that there's currently one case associated with rec camp. And there are 13 close contacts that are in quarantine as a result of that.
Okay. 'Cause I think one of the arguments that I've heard around town
last week, and I can tell you that by mistake, Ted Carroll sent out an email to all the parents. So it kind of spun off of, there was a rainy day last Thursday. Everyone was inside, and that's where the exposure happened. So Ted sent an email out, I believe it was yesterday, by mistake, saying that masks are required, and immediately he got the emails back with, threatening a lawyer, and it's opened up kind of a can of worms. He had to send out an email later just saying, updated guidance, we are really recommending that you wear a mask. So it's a really hot issue.
Right, that's what I was going to say, is that I've heard around town, why would we mandate masks when rec camp is fine? Nobody's wearing masks at rec camp. But I mean, I've seen kids wear them at rec camp, so.
What I don't know if anyone knows the answer to this, but on what grounds would people sue the town? Like, can the town not decide
There's no real basis on that. I mean, they've said that, but
Dr.
Schubert has some.
Yeah, so we looked at this on the Board of Selectmen, and there's case law at the Supreme Court level, Jacobson versus Massachusetts, 1904. So a public health directive, for that matter, forced vaccination, is legal on legal grounds at the Supreme Court level. From that, a lot of the requirements or recommendations from a Board of Health, or even demands and mandates, follow through from that. So they can sue, but they'll sue City Hall, and they'll burn money suing City Hall. And that would be their role, would be to say it is not constitutional from a personal right point of view. It's not going to work.
So, right. Do you have, so Dr. Schubert, so
Yeah, I mean, so you're on good legal ground, no matter what you decide. The town itself is on very good legal grounds if the Board of Health, for that matter, the Board of, Board of Selectmen or town manager makes an authorization for masking or, recommending that vaccination for the, for the members of the town.
yeah.
There'll be blowback though.
Oh,
Yeah.
surely. Yeah.
But that's my point, that this one situation, there will definitely be blowback, and yet I think, you got to be prepared for that. So
it seems like, to Lynn's point, if someone is unvaccinated, whether by choice or by age, right? They're just not allowed to. It seems to me that having a mask mandate for that population is essential. I guess the question is, at what stage do we, considering the high vaccination rate in town, like, I don't know. I really struggle with this, right? Because the number of breakthrough cases is so small, but it's not zero, right? It'll never be zero. But so if we say, if we were to say, let's take out of the schools and actually focus on, the businesses, for example, like we had mask mandates at restaurants and bars and, places of business. Is there a place for that in a town where basically, I don't know, what's the population of kids under 12 even? I mean, it's probably a pretty good number. Does anyone know that number?
I can find out. I have it on a
Ballpark though.
spreadsheet.
Probably about 2,300.
So it's not a small number.
You mean in the town of Cohasset? Didn't you have that on that slide? What percent?
No, it didn't go down that low. It only went down to this is 12 to 15. This is the
12
ones who are,
Okay.
yeah.
I mean, I think from a public health standpoint, if you take the schools, right? So our schools are broken up into, elementary and then middle and high school. I mean, if you talk about the elementary schools, none of those kids are able to be vaccinated. And to me, that's a clear-cut public health issue, right? Where we would want to protect them. And I feel like that's sort of a no-brainer as long as the numbers keep going up and we have that. It's less clear to me when kids can be vaccinated. I know it's a very unpopular stance. But again, I mean, we're here to talk about the public health implications. And I guess that's my concern.
Is the public health part of it. Yeah.
Is the kids who don't have a choice, right? They can't get vaccinated. And there are kids there that are at risk. If they get it, they're not able to fight it.
Yeah, I mean, one of the opinions that I've heard expressed, which is probably depressingly close to reality, is, we're going to get to a point where the virus will continue to mutate. We're going to get new strains all the time. This is just what they do. And there will be breakthrough infections. And so just like with flu season, we expect a certain amount of illness to happen. The matter is one of managing how bad that illness is and what kind of mortality does that lead to? There's going to be a point where COVID becomes one of those manageable things that we just have to deal with. I think year to year, it's just hard to imagine, certainly in the next 2 years anyway, 3 years of this ever just being like, oh yeah, remember when we had MERS? Do you remember MERS? I don't think we're going to be saying that about COVID for quite some time. So I guess the question is, so in the population you just described, right? So let's imagine that only the kids 13 and up have been vaccinated. So it's the middle high school, really. There may be cases, but there will be relatively few breakthrough cases. They will be relatively infrequent. So they'll be relatively infrequent, and of low, relatively low morbidity and low mortality versus unvaccinated. So if we think about the vaccination rate is high in the middle high school, then maybe that's fine. I mean, maybe it's fine. Maybe you're right, Lynn. Maybe we don't need to mandate masks in the high school. Is there, out of curiosity, does the state require teachers to be vaccinated? They don't.
Don't have such a requirement, no.
I do think, Michael, I do think there is something to be said though about considering if you're not vaccinated, then you do have to wear a mask. And, you know, it's sort of the same idea of you have to get a certain amount of shots or you can be told you can't go to school, right?
Right.
I don't think the flu shot is part of that, right? But I mean, there are ones that some parents don't think their kids need, and they're still required to get it. So I think we're at the stage right now. I mean, you're right. In years to come, it'll become like the flu shot maybe. But right now, I think for the protection of all, and again, the fact that there is a population that cannot be vaccinated, that if you are not vaccinated, then you need to wear a mask at school and you need to prove it. I mean,
Yep.
We
Yeah.
learned today, luckily, it sounds like there's only one teacher in the schools that's not vaccinated. So luckily, it's not a huge issue in the schools as for terms of teachers.
right. And I'm talking more about the students, right? I mean,
Oh, yeah.
and I know it's going to be very unpopular as well, but it means if you have the choice, you have the choice.
I'm totally with you on that. I mean, we all had chicken pox when we were kids, but now there's the vaccine for it, and I think that's required by the schools now.
Oh, it is. It
right.
is.
So,
Yeah.
you know, this is well tried and precedented. I do believe, however, that until they're actually formally approved by the FDA, I think that we probably are not going to get very far requiring what's essentially an emergency authorized vaccine, but that may come to pass soon.
I thought Pfizer was near getting full approval.
That's what I mean, near to it. Yeah.
Yeah.
So
If you can't but you can require the masks, right? Right.
Oh, yeah.
At least the school committee can. So I feel like wildly unpopular, but I believe from the public health standpoint that would be where I would think the board would have to land.
Yep, I agree. Dr. Schubert?
So the only other thing that's out there is you've got, you know, an unvaccinated population under the age of 12, which are potentially be in the schools. If they were to bring it home and give it to any unvaccinated person as a vector, is the other potential means for slowing down the infection in the town. Or, for example, you know, over the age of 75, that's where you see the breakthrough. So grandma, grandpa, you know, great aunt is babysitting the kids because the parents are now back at work because we're opened up and mom and dad are both at work. You know, that's the other aspect that's there. So you're not just going to see a spattering of outbreak in the school, but you'll probably see some breakthrough at home with grandparents or parents that are not vaccinated, or breakthroughs that are there. You know, the breakthroughs are not, we haven't seen any breakthrough deaths in 2 months at South Shore, and we're pretty darn busy with, you know, in the past year. So that's the only other thing that's out there. That's it.
So Michael, in terms of what you can do, the Board of Health can either recommend to the school committee, you know, based on science, this is what you believe that any unvaccinated children should be wearing masks, or the Board of Health could actually make a mandate and just, you know, do it across the board. So I think that's kind of maybe the next question for you and Lynn is how do you want to go about it? Do you guys want to do more of a recommendation at this point, or do you want to do a mandate?
So my thinking would be, go ahead, Lynn, go ahead.
No, I was just going to say I wanted to do the recommendation, right? Because we can always come back at a later point.
So we would recommend that the school committee mandate it. for under 12 or for any unvaccinated
For any
individual.
yeah.
So essentially the middle school, the elementary schools, and then also anyone unvaccinated in the high school, middle high school.
Right.
So the question I asked then is, if we're recommending they mandate it, why don't we just mandate it? Do we want to give it to the control of the school committee? Because I mean, this is actually what we talked about at the last meeting, was sort of like, if we take the heat off of the school committee, they're not asking us to, by the way. I just wanted to be clear. But I mean, if we're going to recommend that they mandate it, it's like, well, why don't we just do it?
Well, I guess I would want to hear if they had any opinion. Like, I wouldn't want to mandate it without first having them weigh in on their opinion. Does that
Right.
make sense?
Mhm.
Just so we can hear all sides.
So if we basically made a recommendation, we could make that happen tonight. And then actually that would be a point of discussion for the public, for the special meeting on Monday,
Right.
to see how it goes. I just don't want it to come off as being like, hey, we want to see where the public wins are, and how many people are going to get wound up about it, because I think it's either right or it's not.
Right. I think it's right. I mean, I think it's right. And I stand by our recommendation. It's based on science. I guess I just wouldn't want to tie the hands of the school committee I can't foresee anything that they would say that would change my mind. I just feel like we're having this meeting and I have a feeling there's going to be a lot more input.
No.
Chief Sylvia, do you have your hand up? I just see it.
Yes, I do, as a matter of
Oh.
fact. No problem. I just wanted to mention kind of the bigger picture, and that is all town buildings. Something you might want to give some consideration to is that you treat all town buildings the same way, including the schools. And the recommendation is that, or the requirement is that you wear a mask inside the building. At the fire department, we're pretty much in that mode because we still have a couple of individuals that have not been fully vaccinated. So I put out a directive 2 weeks ago and pretty much made it mandatory again, just for the protection of our own. But that might be something you might want to consider.
So just to let you know, in the town hall, it's mandated if you're not vaccinated, you have to wear a mask. So there's like literally just 2 employees that walk around with a mask. Everybody else has been vaccinated. That's kind of a really controlled environment though, where we know everybody's been vaccinated because we did it basically. And then we just have like a sign when you walk in, if you're a member of the public, just saying, we want you to wear a mask if you're not vaccinated. And people are pretty good about it, I have to say.
So that's a mandate that was put in place by the selectmen or the town manager.
No, that was it's really kind of following what the state's recommendation is. So I guess the CDC actually had a recommendation that had more teeth in it, but that's because they have to take into consideration like so many states that have such poor vaccination rates. So locally, Massachusetts felt like their vaccination rate was so high that they weren't going to exactly adopt the CDC recommendations. They just said masks are for immunocompromised individuals or unvaccinated individuals for indoors. And that's according to the latest that we heard this afternoon. And they don't believe that the governor is going to be making any upcoming changes. It's kind of is what it is right now. I don't think politically he wants to weigh into the mask situation much anymore.
No, and I think with high vaccination rates, right, less of a mandate for people coming in and out of the building, but just the recommendation that you're not, that you wear a mask if you're not vaccinated. I just think it's different, like you said, when you're talking about town employees or the schools, where there are actually people there that have to be there, right? And then you can show proof. You're not going to ask people that walk into town hall to show proof of vaccination, right? And our rates are pretty high. So if you're in town hall, you're 80% chance you're vaccinated.
I think but I mean, sort of the Chief Sylvia's point is actually really, it's relevant to the comment about the rec department's situation also, right? If we have a confirmed case in the rec department and we have kids that are quarantined, it seems pretty clear from our standpoint that they should be required to wear masks, right? So the fire department's mandating it. I think the rec department should be mandated because everyone's there. All the kids there are unvaccinated, right? It's not even a question because they're all under 12, right? So.
But are you saying the employees, regardless of their vaccination status, should be wearing a mask because the population they're serving is unvaccinated?
No, that's not. No, that's not what I was saying. Well, that's not what I was saying. I was actually saying that if you're unvaccinated, the idea being a mandate, if you're unvaccinated in a town facility.
Yes.
I mean, now we might advise even vaccinated people who are working with a bunch of unvaccinated 12-year-olds, we might advise them to wear a mask.
Right.
But the mandate doesn't seem right. So
Agreed.
Chief, how is that? I mean, the fire department is more of a command and control kind of world than the general public's, but how is that received among the department?
Pretty well. Really not a lot of pushback from any of the staff. They fully understand, we've been at this now for 18 months and they understand that you wear a mask to protect others, just as well as to protect yourself. We're not wearing N95s, we're wearing cloth masks with filters in them. But so for the most part, you're wearing that mask to protect those around you. And if that means a couple of unvaccinated members of the department, though it may be, troublesome, it is just what we're doing. So it's really that piece of the puzzle.
Got it. So now we're back to this question about if we mandate it in town facilities, then what does that mean to the school department? I mean, the more we've been talking about it, the more I'm in favor of actually mandating it in town facilities for unvaccinated folks. The school committee would have to take that under advisement, right? And they may decide to make it actually more robust than that. They may actually just say, oh, well, everybody in the schools at all ages, they may decide to be more. I guess what I'm saying is we're sitting here all agreeing that, that if you're not vaccinated and going into a town facility, you should be wearing a mask. That seems to me that is true, whether the school committee likes it or, whether they want to do it or not. It seems like it's just good public health practice. So I think we have to sort of, I think there's some things that we want to put around such a mandate in terms of when will we review it next, right? It's not like the state of emergency where we basically it's on forever. Let's just, we'll review it after X number of months. What other sorts of criteria do you think we need to put in place if we were going to put one in that would at least make people less resistant to it? Any thoughts from experience from the last year? Go ahead, Dr. Schubert.
So I think Provincetown, that outbreak there, it gives very good evidence that you'll still get, even in densely crowded situations, you'll still get breakthroughs in those who are vaccinated. Probably has to do with viral load and repetitive exposure or things like that. So you certainly can take that to say that even those people who are vaccinated potentially can carry it home to someone who is unvaccinated in situations where close quarters, like a school, like a town office, and potentially may have breakthroughs for that. So you can kind of defend saying townwide masking for indoor facilities as a concern for the relative infectious nature of it, along the lines of a chicken pox, and still breakthroughs with vaccinated patients still being able to potentially carry it and spread it. I think we'll see that in the fall as we get closer to everyone indoors. But that's one defense you could use. That's it.
So based on that, so let me make sure I'm understanding. So the idea is the Provincetown mandate is indoor masks for everybody.
That's right. Yeah. I mean, we do it in doctor's offices. They do it in the fire department. I think the police is doing it as well. The hospital is doing it. And, it has remarkably dropped the cross reaction, the nosocomial spread within the hospital, within our office alone. We just haven't seen it, although we're almost all vaccinated. Despite that, even with incredibly high exposure risk, we haven't seen it with just indoor masking and not N95s on everyone.
I guess my concern is, and again, I mean, Cohasset's vaccination rates are pretty high, but the incentive to get vaccinated, right, if you still have to wear masks indoors, I just think at this point, I'm not sure that's going, I just don't know how well received it's going to be. And I agree that it's probably the best practice, but I think you also have to weigh where people are at.
Yeah.
I don't know how you feel about that, Michael. I mean, I see the benefit to it. I know even having kids who are not vaccinated go back to school with masks is controversial. So I feel like we have to sort of weigh the public health good with where people are at.
I mean, the other way to go at it, right, is to mandate it for unvaccinated and strongly recommend for everybody for indoor. Right, that's sort of the middle ground, and with the rationale behind it, right? We can't just say you got to do this, you have to do this. We would strongly suggest that you do that, but here's why. Bam, 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 bam. Breakthrough. We can actually point to the success, because that has been actually pretty effective in Provincetown from my reading, right? So then
I think that's
okay.
actually, oh, I'm sorry. I was going to say that to Lynn's point, once the vaccine becomes available for the younger kids, the 5 to 12 or something, it would give people more incentive to get vaccinated. Because I could see some hesitation with the younger groups. People might be a little afraid with their younger kids or something. And in a way, if it could mean that they wouldn't have to wear masks every day, which, I mean, that's not the greatest either, but it may give people more incentive to get vaccines once they become available.
Yeah. So what do you think, Lynn?
Do you feel strongly about going the mandated for unvaccinated anywhere in public space?
Indoor spaces.
Or indoor space, as opposed to recommendation? And then strong, right.
And with a strong, mandate for unvaccinated, strongly recommend for all others.
And we're able to do that without the Board of Selectmen weighing in, I mean, in terms of them voting on it.
Yep. Yep.
If you make the recommendation,
we're the elected officials that get the flack for it.
Right.
It's awesome. I'm so glad I'm not on Facebook.
Well, Chris Senior is always saying the Board of Health has a lot of power, so you guys definitely have the power to do that.
Yeah, it just seems like the right thing to do at this point.
Oh,
and so what I would say is we give it a 6-week, perhaps a 6-week re-review. So what's at the end of September, and see and just assess what the reality is. And of course, things can change along the way, right? It could get more restrictive if they have to. And we have a next Board of Health meeting in 2 weeks, so we can actually
review this.
Yeah, yes, but we can officially actually put it in the order that it'll be reviewed in 6 weeks.
Okay.
Does that sound okay?
I will vote for it if you make the motion.
Okay, great. Any other comments from anyone before we do the deed?
Well, I just want to weigh in and say that I 100% support you. I think, our job is to protect the public health, and that those kids under 12 don't have a choice, right? They have no choice about whether they get vaccinated or not. And I think that you're doing the right thing. That's your job, is to protect their public health, right?
Right.
Right. All right. Other thoughts? Great. Okay, I'll give this a try. So I move that we establish a Board of Public Health order that mandates indoor mask wearing for all unvaccinated folks within indoor is, let's see, mandate mask usage for all unvaccinated people in the indoor facilities within the town of Cohasset. That's the first one. That's my first motion.
Were we just doing town-owned space?
No, all indoor space.
So indoor public spaces.
Indoor public spaces
Okay.
for unvaccinated people. There's only one of you that consent. There's only one of you that can second it.
Oh, I'll second it. I didn't know you were done. 'Cause
Yes.
I thought we were gonna say- I thought we were
There'll be
gonna
a second one. We'll do
Okay,
2 of them.
okay.
Yeah.
Michael,
Okay,
I just
so-
wanted to ask, is there an age on that, over the age of 2, or did you want to include anything like that?
Actually, yeah, that's a good point. What's the general?
2, over the age of 2.
Yeah, over the age of 2. So any unvaccinated person over the age of 2 in indoor spaces within the town of Cohasset is
What about
mandated to wear a mask.
Medical exemptions?
Yeah. Okay. So this feels like a Monty Python skit now. So right. Except for that. So except with the exception of medical exemptions, children under the age of 2. What other ones have we? Dr. Schubert, are there other things?
Religious exemptions, I think.
And religious.
Yeah.
They do religious Oh, if they're
think
if they're unvaccinated due to religious exemptions.
I didn't
Well, I
think
guess the
Massachusetts.
masking wouldn't. No, the mask wouldn't. Never mind. I'm
Okay.
thinking of vaccination. No, that's fine.
Okay. Do you want to try this one again? Okay.
So it's going to be indoor public spaces. Okay.
Indoor public spaces, which includes like restaurants and. Oh, right. All right, we need to talk this through a little more. So with restaurants.
Yeah, that's a little tricky because the thing is, all the other guidance that we had for places like restaurants is gone, right? So right now, they don't have anything. So the last rule that they had before they took away all their guidance was that people came in with a mask, but once they sat down at their table, they could take their mask off. So you'd have to probably get into specifics like that again, because there's no backing guidance anymore. But let me just tell you though, so as a first step, before you get too far into the weeds, there is this like Massachusetts Public Health Board that they have like a lawyer and they can create documents and stuff. And they just told us during this meeting we had this afternoon at 3 o'clock that they have drafted some mandates, and that's like where, Belmont got theirs from and Salem was probably getting theirs from. So we can get like a template from them. So
Let's do that.
we can get a template and kind of work on it, because it's not going to be something that's going to be done overnight, right? It's going to be a work in progress. So I think you kind of just go with the high level, vote tonight, but then we'll get into the weeds. Like once we get a template, we can start working on it.
Yep, that sounds good. So okay. So then we will operate under the assumption. So maybe the motion is actually indoor mask mandate, all public indoor public spaces in the town of Cohasset for unvaccinated individuals
Over the age of 2.
over the age of 2. What was the other one? Without without medical contraindications, right? Okay. With the language pending, with the definitive language pending guidance from the State Department of Public Health. We need an effective date. Effective 1 week from today. Do we need less time than that? Like when's the how quickly can we get the actual language? Because we gotta have time to get the language together to give to the public, like the restaurants and such.
I think you're gonna need a little bit more time than that, because you're gonna have to kind of tweak it yourselves, and then it's gonna have to go for review through like town council.
Right. Okay. So no effective date yet, but pending language from the State Department of Public Health and reviewed by town council. Do you want to second that, Lynn?
I'll second it, but Chief Sylvia has a question.
Oh, sorry, Chief.
He's on my screen, so I can.
No issues. Just real quick. So just looking at the DPH website, the website itself says the Department of Public Health issued a public health advisory effective July 30th that advises all unvaccinated residents to continue to wear masks in indoor settings and when they can't socially distance. The advisory also recommends that vaccinated residents who are at increased risk for COVID-19 or who live with someone at increased risk should wear a face covering indoors other than their own home. So that's where DPH lives on this right now. I don't know what these other communities are doing, if they're just at this point staying with the DPH recommendation or they're going even a little further. Pam probably has a better feel for that than I do. But I know that's where, since July 30th, that's where they came out with that, which, hate to say this, was a, for lack of a better term, a dumbed down version of what the CDC said. The CDC is a little stricter than that, and Mass decided to be a little bit more lenient. So I think you've got two places you could go. One is to look at the CDC actual language, which is a lot more, I believe, a lot more strict, and then the DPH language, or just use the DPH language or any their combination thereof. You have that ability. So
I think the DPH language is right. Except that instead of recommend, it's require. Right? It would be a find and replace on that document to go from recommend to require, with all those caveats and such and like. So I think yep, Dr. Schubert.
So I have the Provincetown mandate, and it's pretty simple. It says face coverings are required for all workers and customers of indoor public spaces, except where an individual is unable to wear a face mask due to a medical condition or disability. And then it says masking all indoor restaurants, theaters, performances, venues, bars, dance floors, lodgings, fitness centers, offices, or other public facilities. And then there's I can send it to somebody. It basically says the caveats that are in there. Indoor bar and dance venues may only remove when sitting at the table. Fitness centers required to wear face masks during fitness activities, those sorts of things.
I'm a big fan of not reinventing the wheel.
Yeah.
Especially on something that works.
So you could start with just, what they started was face coverings are required for all workers and customers of indoor public spaces, except where individuals unable to wear a face covering due to medical condition or disability. It's kind of like what you said. And then you can always add stuff to it. You can look at the Provincetown one or the DPH one. That's all.
Yeah, and presumably that went through DPH and also their own town council. Right, Pam, do you think?
Yeah. And I was just going to say too, so going down that route of the gyms again, would you be willing to let people, like say a gym owner, allow people in if they could show proof of vaccination, like they're only letting vaccinated people come in and work out? Could they not wear their mask then? And you don't have to even answer that now, but I mean, could you think about that kind of stuff as well?
Personally, I think using the blunt instrument right now might be simply because it's sort of like I can think of a million sort of exceptions where, well, what if this and what if that? Those will certainly percolate up on Lynn's Facebook feed. And that can help inform us in 2 weeks when we need to refine the language, maybe.
Yeah.
I don't know. What do you think, Lynn?
I'm a big proponent of, if you're vaccinated, you don't need to wear a mask indoors. I mean, that's how I feel now. And like I said, I think it's for many reasons. I mean, I think we can strongly encourage it, but I don't think mandating vaccinated people to wear masks indoors is a good idea at this point.
So you changed your mind?
No. If you're not vaccinated, you need to wear a mask. If you're vaccinated, you don't need to wear a mask indoors. But we can strongly encourage that you wear a mask, but I don't want to go down the gym route.
Right. So the Provincetown one is mandated masks indoors for unvaccinated people or all people? You're on mute, Dr. Schubert. Sorry.
It says face coverings are required for all workers and customers of indoor public spaces, except where individuals are unable to wear a face covering due to medical condition or disability.
Okay, so that's stricter than what we were talking about before.
Right, and I think it would be a different story if we had an outbreak or something along those lines. But I think right now we really just need to concentrate on the unvaccinated.
Got it. I can get behind that. I can get behind that.
Thank you.
So, right. Well, so I guess then what we're saying is it's essentially the Provincetown guidelines with their language applied to unvaccinated people. Point A. Point B is strong recommendation for all others to follow that guideline, irrespective of vaccination status. Does that capture what you're saying, Lynn?
Yes.
What we need to do is to have like a Word document open so we can wordsmith this motion and get it right the first time. But it sounds like we got it. It sounds like we got it. It sounds like we have the Provincetown mask mandate adapted for Cohasset for so it's non-public for all public spaces. Unvaccinated individuals are required to wear a mask. All others, vaccinated or not, all others, even if vaccinated, are strongly recommended to mask in public indoor spaces. And then we'll use the language from with the exceptions and all that language from that. And Dr. Schubert, if you could email that to Pam or Amy or Mary or all of us, that would be really, really helpful.
Okay.
And then we'll grab that language. Does that sound good, Lynn?
Yes. So I second that.
Awesome. All in favor?
Aye.
Aye. Motion carries 2-0. Okay.
Chief, do you have another question? I saw your hand go.
No, I was just going to tell you that I just read the Belmont order, and it's pretty much the same thing what Dr. Schubert said, and it went into effect yesterday. So townofbelmont.org, same type of order, and I just sent it to Pam and Mary so they can forward it along to you guys if you want to take a peek at it.
That's terrific. And that's for all individuals, not just unvaccinated. I think so. I mean, to Lynn's point, I think given our high vaccination rate relative to the state, I think we may be in a better position. I mean, yeah, there are people from outside Cohasset that come to our restaurants, we hope. But I think that this is a prudent, good first step. We'll find out what we hear from the school committee next week. We'll find out what kind of response we get, and then we'll go from there. And we'll just got to keep. And right, the last bit of that was that we just need to put an end date on it, or not an end date, but a review date. I'm counting on Amy just capturing the minutes there. Go ahead, Chief.
Not to interrupt, but real quick, the caveat at the very end of the Belmont very simply says, this mandate will be in effect whenever the level of community transmission data from the U.S. Center of Disease Control for Middlesex County is categorized as either substantial or high over a consecutive 2-week period. So they have the ability to back off as soon as they go back to green or whatever the case may be.
Right. Where are we? Where's Norfolk County right now? High?
Substantial.
Substantial.
Right. I sort of feel like we can't really use Norfolk County as a good gauge. I mean, aren't we surrounded by Plymouth County?
Yeah.
Both Plymouth and Norfolk County are substantial right now.
Right, and again, I think for us, the unvaccinated, just including the unvaccinated, I think it's irrelevant where we stand in terms of numbers because they're just not vaccinated. So until everyone can be vaccinated, I feel strongly that indoors you should wear a mask if you're not vaccinated.
Right, and that may be when you change your mind is like
Right.
next summer if all that age group is all vaccinated. I mean,
Right.
everybody got vaccinated really fast when their age group was up, when their
Yeah.
return rolled around.
So,
Yeah, so so this has been an excellent excellent discussion. I think we got to a good place.
Michael, very good first meeting as director. I knew
made slides, Lynn.
I knew I made the right.
slides.
I knew I made the right vote.
I made slides. Anyway, thank you so much, everyone, for participating. Motion to, oh, Dr. Schubert.
So I just wanted to, I jumped in here because I just wanted to kind of give a quick lowdown on what the CDC recommendations are going to be over the next probably 2 weeks. Pfizer is approaching the CDC for full authorization, and it likely will be voted on before Labor Day. And so you'll probably have full authorization, off-label use for anyone 12 years of age and up. So for the Pfizer vaccine. They're also meeting with the ACIP, which is the Advisory Committee on Immunization Recommendations, I think it is. They're meeting on Thursday about booster vaccines for high-risk individuals and individuals who have immunocompromised. There's no vote right now on the agenda, but Thursday they're going to discuss boosters as a third dose for probably for all of the vaccines that are out there. So those are the two things that are coming out. For the kids for age less than 12 to 5, Pfizer is putting forth probably in the next 2 weeks, and Moderna will follow by about 2 weeks, information to the CDC and the FDA about the trials in that age group. That should be available and probably reviewed fairly quickly, and probably by December 1st or maybe even January 1st, you may see recommendations for vaccines for the age of 12 to age 5 with Pfizer, and for Moderna from the age of 17 to 11 to 12, and then from 11 to 5 with Moderna. So that's all.
And then and that's terrific. Thank you for that information. I think also then once it's actually formally approved by the FDA, any of these, when they are approved by the FDA, it seems like then the school department could mandate, right? We could mandate that for the school department, just
That's
like
right.
the chicken pox and everything else.
That's right. They can do it now. It's less strong legal support, because if you think about, back when they did the smallpox in, the 1904 Supreme Court ruling, there was no FDA. So there was no certification of any vaccine. It was just available. So there is legal footing, but it's far stronger when it's fully FDA approved.
Even the military is mandating it by, such and such a date or sooner if approved. So, that speaks volumes in my view. Thank you for that. That's really helpful.
Sure.
Would anyone like to move to adjourn, Lynn?
I'd make a motion to adjourn.
I will second that motion. All in favor?
Aye.
Aye. Thank you, everyone.
Thank you.